Hello, you're welcome. You're welcome onto my channel today, and it gives me great joy to notice you are viewing this video. I am Dr. Olayinka Akanle. I am a lecturer in the university. On this channel, I do a number of stuff, but for you to catch up with the stuff I do, view the playlist on the channel. There are 4 of them to catch up. You'll see the content I do on this playlist. Meanwhile, please click subscribe on your screen right now. Tap subscribe on your screen right now for wonderful content. There are many theories, models on this channel. After this particular one you are viewing, view my playlist on sociology. You will see many different theories and models that will be of assistance to you. You can also view the playlist on research for content that will be of use to you. Today, I want to talk about Heath Belief Model, HBM. This model is one of the most important models or theories anybody will want to use if you are interested in the social sciences of medicine or of health. Because this model, there have been so many written about it, but the application remains a problem. So, and it is very important for us to go through this. If you are interested in human behavior, how human beings behave in health situation. And Heath Belief Model is very comprehensive, very applicable. So stick around till the end for you to understand Heath Belief Model very well. At the end of this video, you should be the master professor of Heath Belief Model. I love Heath Belief Model. I've used it a number of times and very relevant, like I say, very comprehensive. You can apply it in any context where you want to understand human behavior as it affects health, diseases, and health-seeking behavior. So let's break it down this way. A model from Heath Belief Model, a model normally will assist researchers or academics or scholars to frame, to direct, to guide their research. A model should assist to give framework, patterns within which that issue you are interested in will be given boundaries, will be explained technically speaking. So a model should guide your explanation and your propositions. So Heath Belief Model is within the health construct to assist you to understand the implication of human beliefs and their implication for health. Now, look at it. What are beliefs? Though people look at beliefs as religious beliefs or religious practices. Not necessarily. Beliefs generally means organized ways, organized patterns through which human beings explain the world around them. So belief systems may just mean generally the organized ways through which human beings explain issues in their world. That's what we call belief systems. So these belief systems may now be influenced by religion, maybe also be influenced by non-religious values or issues. So issues in the communities, in the societies, people use them to form beliefs. So beliefs simply means organized ways through which people explain their world, the world in which they live. So Heath Belief Model would then simply means a model that assists us in understanding the organized ways people explain their behavior or the world around them on the account of health. A model that assists us to understand how humans, patients, and the significant others, how the model that assists us to understand how people explain in an organized way the world around them relative to health situations. So that's what Heath Belief Model means. So Heath Belief Model simply wants to assist us to understand the people's explanation of particular situations in their world, especially when health is involved. So that's the way I can break it down. So, and I will try as much as possible to apply this Heath Belief Model to some health issues, including COVID-19, which is recent, to assist us to understand Heath Belief Model in a particular way. So, Heath Belief Model is part of the models we call behavioral change model. Behavioral change models generally want to understand how we can understand human behavior so that we can better manage and change their behaviors in terms of health-seeking practices, health-seeking behaviors. So Heath Belief models form within the family of behavioral change models in medicine, in health sciences. And it is very important for us to be able to use this in explaining health-related behavior. So Heath Belief models became popular, was propounded in the early 1950s. In the early 1950s in the United States of America. Unlike many other models, many other theories, we don't give credit in terms of Heath Belief models to an individual, unlike some other theories. But what we know is that Heath Belief model was propounded, was developed by a number of social scientists in public health services in the United States. So these are social scientists who are working in public health sector of the United States in the 1950s when they are trying to understand how people act, how they act in context of health. You see people, you give people prescriptions, they will not adhere to it. You give people instructions to prevent diseases or ill health. Sometimes they don't comply. You see people behaving randomly as if their health does not matter. So we want to understand as social scientists, medical social scientists, trying to understand how people behave in health situations. So this is why Heath Belief models, emerged to understand the human behavior in terms of prevention, in terms of management, in terms of cure, in terms of health, and how people act in these circumstances. We're talking about prevention of COVID-19, prevention of cancer, prevention of pneumonia, prevention of diseases or sicknesses. How do we prevent these diseases? How do we ensure compliance? How do we manage health situation? How do we cure health situation? And how do people, because sometimes people's behavior can be frustrating sometimes in context of health. So we want to understand how people behave in these instances. And this is what Heath Belief model want to do. And if you look at it during COVID-19, even though we say we have so many COVID-19 prevention protocols like social distancing, vaccine uptake, or some people just refuse to comply with safety measures during even COVID-19, as dangerous as COVID-19 was. And even in terms of cholera in some poor countries, basic hygiene practices, people still find it difficult to comply. Why some comply? So how do we explain this? And when you look at it in terms of people having symptoms, yet refuse to take proactive health behavior, people refuse to comply with medical treatment, they refuse to comply with their symptoms and prognosis. So how do we do this? How do we explain all of this? This is what Heath Belief model wants to achieve. And if you are doing any research in terms of human behavior, in terms of how people behave, and how these have implications for their health outcomes or health behavior, so Heath Belief model will assist you. So what are the major propositions of Heath Belief model? Main propositions, you can see it this way. Number one, a person's belief in a personal threat, of an illness or disease, together with a person's belief in the effectiveness of the health behavior or action will predict the likelihood of the persons adopting that particular behavior. What does that mean? Okay, if a person believes that he's threatened by a particular disease, if a person believes that he's threatened by COVID-19, he's threatened by cholera, he's threatened by cancer, he's threatened by all manners of diseases, or health situation, if that person believes that he's threatened, and he believes that if he or she takes a particular action, it will be effective in protecting him or her, or in curing him or her, that will likely predict the likelihood, or will predict the fact that that person will take that action or that behavior that will make him to achieve that particular prevention of diseases. So if, for example, if somebody believes that is susceptible to pneumonia, and that for you to pneumonia, there are some things you need to do to not contract pneumonia. So if the person believes that is susceptible to it, and is susceptible to attack, let's say somebody that has asthma, believes that, okay, if it moves close to smoke, it can trigger the asthma. and this person will likely not go towards smoke. And if the person believes that, okay, if he goes towards smoke, but if he takes inhaler, it will be effective in preventing him from crisis from crisis. So this person will most likely avoid smoke. At the same time, this person will go around with inhaler and use inhaler in the case of asthma. But if this person believes that nothing will happen, even if I go close to smoke, nothing will happen to me, the person will likely take actions that will jeopardize your interest. And if the person believes that even if I go to smoke, if I have asthma attack, inhaler will not assist me, will never be effective, that person will not use inhaler. And unlike the other way around. So this is a major, so Heath Belief Model, don't forget this I want to mention, is predictive. It's very important in predicting action of people relative to health. That if you believe that you are threatened by a disease and you believe in the effectiveness of a particular health behavior, then you are most likely to adopt that health behavior. That's the hypothesis, and it's predictive. We believe that is a very certain scenario. So susceptibility or vulnerability to illness and belief in the effectiveness of a particular health-seeking action will definitely predict the person's health behavior. And this is very important. So essentially, we can say that the basis of Heath Belief Model can be regarded as psychological and behavioral. So you have psychological component of Heath Belief Model and you have behavioral component. So Heath Belief Model is an amalgam of psychological and behavioral theoretical propositions, looking at individual psychological makeup and the behavioral makeup of the person as a member of society, determining the course of action that people will take. So it's an amalgam of psychological principles and behavioral principles in the context of health. So there are two major components of health-related behavior that Heath Belief Model want to explain. That is the desire to avoid illness. You must not forget the desire to avoid illness, or conversely get well if the person is already healed. Then number two, the belief that a specific health action will prevent that or cure the illness or disease, we make the person to act in a certain way. So overall, if an individual believes in the course of action, would depend on the person's belief in the benefits or barriers of that, of a specific health action in the long run. So if you believe you believe essentially that, okay, you want to avoid ill health or disease, or the person is already sick, but the person wants to get well, and the person believes that taking a specific health-related behavior will prevent that disease or will cure that disease, certainly will determine how the person behaves positively. Or if the person does not want to avoid illness, does not even believe, does not want to get well, does not believe that taking an action will lead to positive results, the person will not take that action. So we must look at the orientation of the individual, perception of the individual, belief of the individual. If you are a medical doctor or you are a social worker, you are attending to somebody on the account of health, you must ask yourself, does this person even believe that this disease is real? Does this person believe that he is sick? Does this person believe that this action can even lead to solution or cure or prevention before you decimate your energy on that particular patient? That's why this is very important. So there are, we have six fundamental constructs of Heath Belief Model. 6, but 4 are very traditional. 2 were later additions. So what are these 6? Let me start with the first 4 that were traditional to Heath Belief Model. We call it passive susceptibility, we have passive severity, we have passive benefits, and we have passive barriers. These are the 4 originally. So 2 were added later as a sort of applying and improving Heath Belief Model. Number 5, which 5 and 6 are the last two. So the 5 will then be cue to action, and number 6 will be self-efficacy. So let's look at passive susceptibility. This means a person's feeling or belief or being susceptible to risk of disease or illness. That's what I mean by passive susceptibility. That is, that person believes and is feeling and he perceives that is susceptible to risk. He has the possibility of contracting disease. He has the conviction that he can be sick on the account of a particular behavior. It will inform the overall behavior of the person. And that would determine whether the person will act in a certain manner. If the person believes that, based on passive susceptibility, he can acquire illness or disease, that's very important in determining action. Then you can look at the second one, passive severity. This is a person's feelings or belief in the seriousness of contracting a particular disease. If a person believes that, this disease is serious, COVID-19 is serious, asthma attack is serious, pneumonia is serious, I must not contract this infection because it's severe, it can lead to death, then the person is likely to behave in a way that is controlled. And, and this in terms of passive severity, people will look at this passive severity in two ways. Well, number one is medical. That is, it can lead to disability or death. That is medical consequences. This is what will determine the person's feeling or belief in passive severity. Then the second leg, aside the medical, is the social. If the person believes that, if I contract this disease, it can make me lose my job, it can make me lose my marriage, it can make me lose my children. So the person will likely behave in a way that is very measured. So the third one is perceived benefit. The perceived benefit, if this is belief of the feeling that of effectiveness of taking various action of reducing threat of illness or disease. So if the person believes that if I take this action, it will give me benefit, it will prevent the disease if he's not sick yet or she's sick yet, or it can cure the situation or it can manage. So this is very particularly important for people who have terminal diseases, people treating cancer. So some people just believe, well, this terminal, nothing can be done. But if such people believe that taking some medications, chemotherapy, or going through random tests or some other things, will have benefit, they will take. That's why this expert to explain why some patients will reject care or treatment, and some will take treatment and care. It's because of perceived benefit of such people. So the fourth one is perceived barriers. Perceived barriers talk about feelings or belief that there are obstacles, impediments, challenges exist to performing particular health-related actions. Those people so these barriers can be distance, can be finance, and in examining these perceived barriers, people do cost-benefit analysis. What benefits? Sometimes social barriers also exist. So you can have financial barriers, medical barriers, informational barriers, and some distance barrier, or poor access to healthcare facilities. So people then do cost-benefit analysis to be able to see what can happen, how they can overcome this barrier. If they want to, what benefit am I going to get if I go through this? The barrier can even be stress. So we then do cost-benefit analysis. But for people who believe that the cost will outweigh the benefit, they may see the barrier as prohibitive. But for those who believe that the benefit will outweigh the cost, then they can see the barrier as surmountable and take action. So if people believe that the barrier is too humongous that they cannot overcome it, definitely they will not take positive action and may take negative action. So then the number C, the fifth one is cue to action. Cue to action refers to the stimulus needed to trigger decision making that can lead to health-related action. If the stimulus, people feeling the stimulus, remember the stimulus response? Remember, they are stimulated by certain factors to take action. That's what we call cue for action. And this stimulus can be internal and can be external. Internal stimuli can be symptoms that people feel, as all the pain that they have. sick people, when they have pain, the pain can be like a stimulus for them to take action, or symptoms that they keep feeling, maybe they to take action. And the external can be issue of maybe advice, prescription, or advice, piece of advice from medical experts, or even from their social network, kinship network, or their friends, neighbors, or even superiors in the office, that individuals should take a particular action. Then the number 6 construct is self-efficacy, which means the level of somebody's confidence in his or her ability to successfully, perform that behavior that will make him reach the result. So level of person's confidence, ability to successfully, perform a particular behavior related to health. And this is very important. If you believe, okay, if I have the confidence that if I take this action, it will prevent this disease, or it can cure this disease, or it can help me better manage this disease. So, but these last two, the cue to action and self-efficacy, were added in the mid-1980s, by social scientists, as they want to better expand, as they were responding to many criticism from critic, against Heath Belief Model. So there are many limitations or criticism to this. Some people believe that Heath Belief Model is too psychological. It pays too much attention to the individual capacity to feel, to reason, without paying sufficient attention to attitude, behavioral determinants within individual contextual environment. And some people believe that it does not account for addiction, actions that have become addictive. People believe that smoking is dangerous to, medical scientists believe that smoking is dangerous to health, yet people smoke. Alcoholism is dangerous for pregnancy, yet pregnant people drink alcohol, consume it excessively. So they believe that Heath Belief Model does not account for addictive behavior, or the roles of culture, the roles of environment, the role of the economy, some barriers that are beyond the individual's control. And Heath Belief Model is believed that everybody have access to information about all these constructs that can make them make informed decisions. But there are people who don't have access to information, people in rural areas, the illiterate who cannot go online. So there is differential access to information. And a major criticism is that it's too descriptive, talking about how people behave without explaining why they behave in that way. So they believe it's too descriptive, but not analytical enough and not explanatory enough. And a lot of people believe that all these criticisms are so weighty that it makes the role or the usefulness of Heath Belief Model very limited and very minimal. But I believe, generally speaking, that based on this analysis I've done today, Heath Belief Model is very relevant. This criticism is notwithstanding, and it's not surprising that it's one of the most popular theories or models from the perspective of social sciences in medicine and health sciences of public health. So that's Heath Belief Model for you, and I seriously recommend Heath Belief Model for you as at least a first level analysis in your research. I wish you well. Kindly click subscribe. Bye for now.